doors, or even behind iron walls, to feel the need to be set free. You want to liberate your mind, controlling secrets, yet you will find the need to be set free. And the Lord says, captives be free, just come to me. I'll break those chains that hold you down.
Hi, everybody. Welcome to Heroes of Hope. We're here today with another episode bringing you an individual that's going to share testimony. But before we do, I just want to make sure that you're aware of the fact that Heroes of Hope, this show, has been created to bring you organizations, testimonies, churches, and programs together to be able to raise awareness and give you resources and also give you hope in reference to the fact that there are many lives that are being touched, changed, and transformed, and we want to be able to bring them to you through this show called Heroes of Hope. So tune in for all these episodes because it comes from every angle throughout Staten Island and through every organization, even public officials. So we're really excited about this show. Today we have with us Al Crespo, and we just want you to welcome him. Thank you so much, Al, for showing up today and being a part of Heroes of Hope. I thank you for coming.
My pleasure.
You know, we have a few questions that we want to ask you, but the first thing that we want to ask you is for you to maybe tell the viewers a little more about yourself, you know, so that they can get to know you and get a feel of, you know, where you come from and things like that.
Well, I grew up right across the way. I grew up in Brooklyn in Sunset Park most of my life, and from there I worked some part-time jobs over there, Herman's and Margolis Stationery, and then from there an opportunity arose for me to work with the police department. I wanted to work with the police department because, to be quite honest, I needed security, and the police department offered that, you know, through good health benefits and I wanted to make a difference. I grew up in a community where you saw a lot in Sunset Park.
Yeah.
And seeing a lot, I wanted to make a difference. And that's what got me into the police department. And I got to do the police department for about 15 years. And unfortunately, I got running after a bad guy. I fell down the stairs in the subway, hurt my back. And because of my back issues, I was retired from the police department. And not soon after that, I ended up being a Staten Islander. So now I'm native to Staten Island. And that's basically it.
So when you know, this show is dedicated to the drug epidemic and stuff, and since you've been here for 15 years now or more, my question to you is in reference to the drug epidemic here in Staten Island. You know, what are your thoughts about that? You know, what's going on out here in Staten Island concerning this whole drug madness that's happening?
Well, it's terrible. To see that an island is at siege, you know, with this epidemic. And I know it's not just the island. I know that we see it in the island because we live here, but it's across the 5 boroughs, and it's just terrible to see the effects that it's having on neighborhoods. And we're not talking about bad neighborhoods. We're talking about fluent neighborhoods that are being affected, you know, because the drug epidemic has no boundaries, you know. So to see people that don't expect it, they have this perception that the drug epidemic belongs in the poor neighborhoods, and that's a total farce.
Yeah.
You know, because we're seeing right now that in the best of neighborhoods in Staten Island, the best of neighborhoods in the city are dealing with this epidemic of addiction.
It's definitely true. When it comes to this epidemic here in Staten Island, the statistics show throughout the 5 boroughs that per capita, Staten Island leads all the boroughs, and there's nothing to brag about, you know? That's not one of the categories you want to be in the lead of, but we are at the top of the list when it comes to overdoses, and I believe we're very close to being tied with Brooklyn, I believe, for overdoses. For suicides. And so it leaves us in a very, very vulnerable place, being such a small borough, but yet these statistics being so high. And your story behind everything that you've been through carries a twist to addiction also. You know, a lot of times people think of addiction and they think, you know, that drug addict that they see standing on the corner. And they don't realize that addiction comes, it has a view, and it comes in many different forms. And I would love for you to share with our viewers today how addiction kind of gripped you at a season in your life with everything that you've been through.
Well, to be quite honest, it just bit me one day. As you know, I got hurt on the job, and I needed to get help for my back. I had 3 surgeries by that point, 3 surgeries. And I started doing physical therapy. And physical therapy basically told me, there's nothing we can do for you. We're going to put you with pain management. I did pain management for like 5 years at 300 pills a month, you know. And it got to the point that it slowly crept up on me. And the next thing you know, it affected my marriage. You know, I had I had separation with my marriage. I lost my home over it. You know, and you don't want to think that it's going to happen to you, but it did. And finally, what I had to do was I had to seek help, because in order for me to restore or try to restore that marriage, my wife wanted to hear nothing but, you need help, and I needed to get help. And on my own, I went to seek help through the Y, you know. And I went to the Y, and I was just so fortunate to deal with a bunch of caring individuals that really cared for what I was going. But I was also embarrassed, because all this happened while I was a deacon at the church, okay? And I was embarrassed to even go help. And one of the things you had to do was, the Y is an outpatient program, and there was accountability, because every couple of days or every day you might have gotten tested. And to see the people and the young people that were affected by this was really heartbreaking, because it cost them a lot. And it cost a lot of people that were on the program a lot. But I was able to go to the program. It was a year program. A lot of good people that tried to help me in the program and work with me and with finances and everything. And they were able to work with me during that whole year. And I remember one of the prerequisites that you had to do was you had to do a 12-step program with going to the Y. That was mandatory. And I went. They told me to start going to the AA meetings. I was addicted to pills. I was addicted to oxycodone, hydrocodone, you know, and I still remember my first pill, you know, because I remember that it took my pain away, and I just felt light, and it felt good. That was my first. I remember the first pill I took. And after that was just a spiral, a down spiral that I thought I had control of it, and it took control of me. And because of that, I paid a price that was very high, you know, almost costing my marriage. And like I said, I lost my home over it. So I continued going to the AA meetings, and in reality, I should have gone to NA meetings.
I was going to ask you.
Yeah.
I was like, AA. What are you going to AA for?
Well, I had gone to I was supposed to go to NA meetings, but I had gone to a couple of the NA meetings, and I didn't really. It wasn't for me. I just didn't like the stories that were going on, and I just felt a little bit more comfortable with the AA meetings. They were okay with that. The program was okay with that. The Y was okay with that. So I did that, and eventually even the AA, they had a little bit of a struggle with it because I was struggling with pills, not with alcohol.
Right.
So I had to win them over. So one of the things that you do with AA is that you volunteered, and that's one of the first things I did. Look, I'm gonna volunteer to make the coffee for the program. He goes, okay, great. So I did that, and started bringing some cake over, and I won the hearts over of the people through some cake.
Went through the stomach.
Yeah. But let me tell you, that first meeting that I went with the AA. Remember, I was embarrassed because of being a deacon, and I was embarrassed until the first guy who spoke said he was a priest.
Mm.
And that's when I realized, wow, addiction, alcohol knows no boundaries, knows no barriers. Everybody can fall into this.
Mm-hmm.
And once I heard that priest speaking, that embarrassment ceased. Because I was like, man, if it happened to a priest, I'm just a deacon. It can happen to me. You know what I'm saying? It can happen to anybody. So, and I saw a lot of people. I saw lawyers.
Yeah.
And people that with great careers that really got addicted into these things. And pills and alcohol. And it was really sad. But so I did the Y. I did the whole year, and I great people. I had Floyd and Kathy and Denise and Barbara Lindsay, who were instrumental in helping me and getting me help, and that's what I did.
I believe with all my heart that part of the YMCA moment that you had there, and then also the faith you have in God, was really used in a powerful way to be able to see transformation take place in your life. And I truly believe that people can be transformed, that people can be changed. They don't have to stay in that web of life of addiction. I really truly believe that. You don't see that everywhere, but we do believe, and we have faith in that. I want to ask you to, there's a lot of viewers out there right now that know exactly how you feel. They work, they have a career, they have a life, and there's an addiction taking place because of things that have happened that are legitimate, disability and stuff like that. And they're embarrassed. They're embarrassed about talking about it. They don't want to bring it to a group. They don't want to come out of denial with it in that sense. But yet they're struggling with it. And I want to encourage you to look in the camera and tell the viewers something from your heart in reference to give them a word of encouragement and hope of transformation for yourself.
Well, I would encourage the viewers out there that if you're struggling or with addiction or alcohol, that don't be embarrassed. I was in your shoes. I was embarrassed. I didn't think it could happen to me, and it did. And don't be embarrassed. You have a lot of people, a lot of good programs out there that are willing to give their time and to give their efforts in helping you out. And you have programs like the Y, Heroes of Hope, and Celebrate Recovery, that just to mention a few, and AA. There are things that you can do, but I have to tell you, in my life, in my personal life, that wasn't just it. My faith had a lot to do with that, because not only did I go through the program with the Y, but it was being plugged into my church, and through a good friend of mine, a deacon here in the church, who really helped me through those times, and the men who surrounded me during my time of difficulty and encouraged me. And the times that I wanted to give up, they also helped me to tell me, no, you stay the course in that program. We're here. You got to do this. And I did. So I encourage you, don't be embarrassed. This is something that, if you need to possibly save a marriage, a family, these are things you have to do. And you have people, loving people, that are willing to help and give up their time. So seek help. Don't be embarrassed. That's what I would say.
It's awesome. I appreciate everything that you're sharing today. I want to tell you right now, those out there that are listening, there's resources about to hit that screen. Get a pen, write down the information, because it's very important that you take advantage of everything that we're providing to you from Heroes of Hope. We want to thank you for tuning in with us today. We do have a second half to this program, and it's here just for you. Bye-bye.
Bye.
Hi, everybody. Welcome back to Heroes of Hope. We're real excited to be able to bring you the second half of the show. We have today with us in the second half Angel Rivera from Community Health Action. They are working here in Staten Island and addressing the drug epidemic and then also other things through their organization. So why don't we welcome him first and find out a little more about him. Welcome, Angel. Thank you so much for coming down and being a part of Heroes of Hope. I'm sure the viewers want to know first a little more about yourself, some of the history of yourself and things like that. How'd you get involved with Community Health Action?
Okay, so I've been involved with the field of helping people out in the community for over 25 years. It actually started as a result of the death of my sister, who at one time had HIV, and because at that time they didn't know anything about medication, so she dehydrated and unfortunately she died. And as a result of that, I really got involved with that community and really got involved in helping other people as a result of what transpired with my sister.
Awesome. That's a great organization, Community Health Action. Let me ask you this, in reference to you being here in Staten Island, there's a drug epidemic taking place. What are your thoughts about what's happening here in Staten Island with all the drugs and the different articles that we're constantly reading and the statistics that are crazy?
Yeah, it's really sad to know that we're having a very, very big problem with people using drugs, and I know it's hurting not only the individual but also the families. And sometimes a lot of people don't know that they have authentic resources out there that are able to help them out. And we really want people to know that we are here and we really want to help people out, and collaborate together to find some kind of healing for the people of Staten Island.
Share with us about Community Health Action. How exactly does Community Health Action address the drug epidemic? I know we all work in different ways and address it, and we all got a different piece of the puzzle.
Absolutely.
And so, what is it that you guys do?
So Community Health Action in Staten Island has been around for over 25 years, trying to improve the health of the clients that come through our organization. So we have many departments, and we have our own addiction treatment programs, and we actually are excited of a new program that we have, and it's called our Resource Center. We call it Next Step. And it's 24 hours a day, 7 days a week. We have very skilled staff that are there to help people out, to do the intake, to have calls if they need to call. It doesn't necessarily mean if an individual is actually in addiction right now, but they may be in recovery and they're thinking about, how do I deal with this situation? And we are there to help them out, to make sure that they have a platform, a safe platform where they could come to help get the help that they need, and also the resources they need to move forward.
Yeah.
Yeah.
When it comes to the drug epidemic, I noticed that you guys have your mobile trucks
Yes.
that are in the community driving around. What exactly do you do through those
So-
mobile units?
So we address those issues. We have people that are addicted to drugs, and we continue screening them for HIV, hepatitis C. We also provide safe syringes, because we know that the community of people that's going to be using, so we want to be able to provide them, the syringes and the boxes and Narcan training, so understand how to, if they encounter the overdose, they'll be able to utilize Narcan to help them overcome that, at least to come out of that overdose. So we have a lot of information. We have condoms there. We educate people while we inside those mobile units, and we also refer them to different agency within our agency to get the help that they need, because sometimes those people, they may not even have medical care. So we have our own medical care under Bright Point Health, and it's in 57 Bay Street. And we got medical care as well as dental, and you'd be surprised, some of those people, unfortunately, haven't seen the primary care provider in such a long time.
Yeah.
So we coordinate together within the department, and as well as other people in the community.
That's pretty awesome. I know you guys are expanding. I checked your website and I noticed that you've received a nice government funding some finances towards your organization. So this next step is something that you guys are real excited about.
Yes.
But when it comes to this drug epidemic, are you guys connected with like residential programs that you guys like as referrals, or do you do referrals and stuff like that?
So in our department, we have various different places. Like we have health home care management, and depending on we have clients that are addicted to heroin or drugs, we are able to, if our organization are unable to help them out, they may need detox, we connect with Staten Island University Hospital, with Richmond University Hospital, Daytop, other areas that are adequately fit to help this client out.
Oh, that's awesome. See, that's the key to the puzzle, being able to not be an entity to yourself, but to work together, here in Staten Island. It's been exciting to see from the political field to the NYPD to the medical field, what was I going to say, the political field, medical field, police department, and all the different agencies like TISA and the YMCA and your organization coming together with also the churches.
Absolutely.
And different 12-step programs and Celebrate Recovery and Renewals and all these different things that are coming together to work in unification. What are your thoughts about something like that? I noticed that it's not happening everywhere. That unity is not taking place in every borough or every state.
Right.
But here in Staten Island, we boast about that because something special is happening. What are your thoughts about that?
I love collaborating with people. I think that to bring healing and wholeness takes the whole community. So it's wonderful to see that we can coordinate together. We can work together to make sure that individual find that healing, that wholeness once again, in their life as well as for their family. And working with the police department, working with hospitals, working with various organizations, that's a plus for the client and for their family. So
Absolutely.
we welcome that. We really are passionate about that. We really enjoy collaborating efforts with other people. As a matter of fact, in our health home care management, that's the key to deal with multidisciplinary teams, so we could come together and find, create a resolution for the clients to enjoy that healing process, and to have them to take them to even beyond that. Maybe they need employment, maybe they need housing, maybe they need other stuff, and we help them out with those areas too.
That's awesome. Let me ask you this. When it comes to your location, I know you said 57 Bay Street?
56.
56 Bay Street. Is there other locations on Staten Island? That's your main headquarters in Staten Island, and from there you work?
Yeah, so we have 56 Bay Street is like kind of like main headquarters, I would call it.
Yeah.
But we have various departments at like 25 Victory Boulevard. We have it in 25 Hyatt. That's our HIV screening as well as for hepatitis. Right across the street, we have our Bright Point Clinic. So we provide medical care, and we also provide dental care. And whether people have Medicaid, Medicare, or no health insurance, we are able to see them and able to provide them a primary care provider.
Yeah, see, that's awesome, because especially when you're thinking about people that are strung out, people that are really, really hurting in addiction. I know you had mentioned people that are even in recovery, that are like making their way back into society, and the pressures of life can get to them. But then there's also those that are on drugs and need care, need to be able to find ways to be able to be taken care of, and at the same time you're able to actually speak hope into their lives.
Absolutely.
They're going for a dental issue, but there's other things that are capable of doing when they get exposed to your organization.
Sure.
I'm real excited about being able to have you here with Community Health Action, and I look forward to working together with you this year. We have a few things that are going on throughout the year with Heroes of Hope, and I hope that we can all just come together and make a difference, and we build stages for people to be able to address the epidemic and bring what they bring to the table.
Yes.
You know what I mean?
Absolutely.
And we're just one piece of the puzzle. You got somebody that's dealing with housing.
Yes.
someone that's dealing with food, someone that's dealing with medical assistance and things like that. Some people that are dealing with faith.
Yes.
And so in every area is needed within an individual finding wholeness, and we all have a piece of that.
Absolutely.
And so when we're smart enough to come together and say, you know what, we all have a piece, let's do this together, it's attractive. I really, really believe it's attractive. And so this year, we are doing some stuff with Heroes of Hope, and we want to be able to let you know that you are more than welcome with your organization to be a part of everything that we're doing, so that we can get to know each other even better and take this thing to a whole nother level so that we could touch more lives.
Absolutely.
I want to ask you to really do me a favor. There's a lot of people that are out there right now, they're probably viewing right now, and they heard a testimony of the first half of a gentleman by the name of Al Crespo that was of NYPD and was wounded on the job, hurt on the job, ended up retiring, and became addicted to painkillers because of the surgeries that he went through. And now we're hearing from your organization. What is it that you can share with the viewers right now to take that time to look into that camera and share with the viewers how they can come out of, there's a lot of people in denial. They don't want to come out to get help because they're ashamed or anything that's holding them back.
Sure.
What can you share with them to motivate them and to encourage them and to give them hope? Today you're sitting at a table and you're a hero of hope. And so what can you give them to draw them out, and let them see that even your agency's here to help them and love on them and embrace them in the situations they're going through?
Yes.
It's all yours, my brother.
So I want the viewers to know that you're not alone. We are here to help. You actually have a lot of beautiful organizations, and our organizations are there to help you. You're not alone. When you feel that you're alone, this is why we have the Next Step resource centers, because we know that at any given time people go through a lot of struggles. Everybody goes through different struggles, but we want you to know that you are not alone. You can always get in contact with us at 718-808-1450, and you could call 24 hours a day, 7 days a week. Anytime that you feel discouraged, you feel down, you feel like so many overwhelming thoughts are entering into your mind and you really, really need help, we are here to help you out. Just pick up that call, make that phone call, call us, and we are able to help you out immediately. We'll reach out to you where you are. We are not judgmental. We know that everybody goes through different things, but we want you to have that safe space with us and to be, to feel comfortable and coming to us to get the help. And we are here to help you out. We have everything that you can actually imagine, that we can help you out with a lot of different ways, not just with your addiction, but maybe other secondary issues that you may have, whether for your health, mental health, other stuff. We could put those things in place for you. Don't feel like you're alone. Know that you have, hope. There is hope out there. Thank you.
Well, you heard this live right here, and I'm excited because this episode was very, very powerful. You were able to hear from an agency, Community Health Action. You were able to hear from a testimony of the NYPD, Al Crespo. God bless you. Talk to you soon.